Hello, and welcome to part 1 of facial bone anatomy. So remember, there are 14 facial bones, and each of the facial bones can be identified on frontal and lateral drawings except the two palatine bones and the vomer. Both of those bones are located internally and are not visible from the exterior. And we'll take a closer look at those in a little bit. Of the 14 bones that make up the facial skeleton, only 2 are single bones. The remaining 12 consist of 6 pairs of bones with similar bones on each side of the face. So we have 2 maxilla, we have 2 zygomatic bones, 2 lacrimal bones, which is the dark green, 2 nasal bones, which is the light green, 2 inferior nasal concha, which are here kind of in a light brown color, 2 palatine bones, which again we can't see because they're internal, 1 vomer, which again we can't see, and 1 mandible. And of course that is that teal color here. So in this lecture, we're going to discuss specifics of each of these different facial bones. So let's begin with the maxilla. The 2 maxillary bones are the largest immovable bones of the face. The only facial bone larger than the maxilla is the movable lower jaw or the mandible. All of the other bones of the upper facial area are closely associated with these 2 maxillary bones. So in other words, the maxilla articulates with a number of other facial bones. The maxilla are structurally the most important bones of the upper face. The right and left maxillary bones are united at the midline below the nasal septum. You can see that here. And each maxilla helps create 3 different cavities within our face. So the mouth, part of the maxilla helps create the mouth or the oral cavity, the nasal cavity, and then the orbits. And we'll talk about that more here. Each maxilla consists of a centrally located body, which you can see here, and then 4 different processes that project from the body. The body is the centrally located portion that lies lateral to the nose. And we really need to identify the 4 processes. So we'll identify 3 processes here, and then the 4th process we'll talk about on the next slide. The processes of the maxilla articulate with other bones, and that's how they get their name. So the first process to discuss is the frontal process, and you can see that here in orange. The frontal process projects upward along the lateral border of the nose towards the frontal bone. So just to orientate you, this light green would be one of our nasal bones, and then here the frontal process articulates with the frontal bone, and you can kind of see that on the diagram here. The second process we need to know is called the zygomatic process, and that is right here in yellow. The zygomatic process projects laterally to unite with the zygoma, and the zygoma is another facial bone. You can see that relationship right here, and we'll talk more about the zygoma in a little bit. The third process is the alveolar process, and that is in green here. The alveolar process is the inferior aspect of the body of each maxilla, and 8 upper teeth occur along the inferior margin of the alveolar process. So in other words, the teeth live within the bottom of this alveolar process. The alveolar process is the bottom of the body. Okay, so the 2 maxilla are joined in the middle anteriorly, and you can see that joint here. At the upper part of the junction is the anterior nasal spine, and you see that on the diagram here. A blow to the nose can result in a separation of the nasal spine from the maxilla. And remember, the acanthion is the surface landmark between the nose and the upper lip, which we can see here. So let's look at the frontal view of the maxilla for a minute. Here the maxilla is shaded in blue. You can again see the three processes that we just discussed. The frontal process that articulates with the frontal bone, the zygomatic process that articulates with the zygoma, and then of course the alveolar process which holds our teeth. The body of each maxillary bone contains a large air-filled cavity known as the maxillary sinus, and you can see that in purple here on our diagram. The sinuses, and remember we have 4 sets of sinuses, communicate with the nasal cavity and are collectively termed the paranasal sinuses. And we'll talk more about sinuses in another lecture. Okay, let's talk about the 4th process of the maxilla bone. The 4th process is called the palatine process, and it can only be visualized on an inferior view of the 2 maxilla. So in this case, we are looking upward at the roof of the mouth. It's as though we've removed the bottom jaw and we're looking upward. The 2 palatine processes form the front of the roof of the mouth, and that's what you see here in this tan. This is all maxilla bone, and it's specifically called the palatine process of the maxilla. The 2 palatine processes are united at the midline to form a synarthroidal or immovable joint. And again, here's that joint, and again together these form the anterior portion of the bony palate or the hard palate. A common congenital defect that you're probably familiar with is called a cleft palate. A cleft palate is an opening between the palatine processes that is caused by an incomplete joining of these 2 bones. So you'd have an opening here, and that creates the cleft palate. The horizontal portion of 2 other facial bones, the palatine bones, form the posterior part of the hard palate. And only the horizontal portions of that L-shaped palatine bone are visible on this view. So imagine, again, we're looking up at the roof of the mouth. The palatine bone is an L-shaped bone, and this is the bottom of the L. And we'll take a closer look at palatine bone here in a little while. The 2 small inferior portions of the sphenoid bone, which remember is a cranial bone, are also visible on this inferior view of the hard palate. And you can see them here in orange. The 2 processes are called the pterygoid hamuli, and they're kind of the feet of the bat. If you picture the sphenoid bone as that bat with its wings extended and its feet hanging down. So these are the little processes of sphenoid bone. Lastly, each maxilla articulates with 2 cranial bones, the frontal and the ethmoid, and with 7 facial bones, the zygoma, the lacrimal, nasal, palatine, inferior nasal concha, vomer, and the adjacent maxilla. And certainly we'll practice with that information in lecture. So we're going to pause part 1 here. We will begin part 2 with the zygoma.